So for this week's focus session, we're looking at the thoracic back. We're going to go through our stomach massage, which is a rolling pattern attached to a squat position. It's focused deeply on the upper back and between the shoulder blades, that deep mid-center back. So coming into a standing upright posture, relax the shoulders and switch onto the T-zone. Keep the knees soft and think about your neutral spine here. Take a soft breath in, start to push the bum back and down as you hinge forwards from the hips, and then start to run your hands down your thighs just above your kneecaps. Notice that my spine is still in a neutral position with a small tilt forwards of the pelvis in the squat position, but I'm not arching through the lumbar spine and lifting the tailbone up. I'm softly drawing the tailbone down as I push my hips back and down. Now I'm going to tuck my chin all the way under to look at my heels and take a breath in. Notice that I've rotated my elbows out, pushed my hands into my thighs. As I scoop my abdominals and press heels into the mat, hands into thighs, I'm going to scoop through the tummy, rounding through the upper back to send the shoulders wide. Now I've created this lovely barreled chest. As I push against my heels, still scooping those abdominals, exhale. I'm going to roll myself on upright, utilising that lovely rounding of the back. And then I float my chest, releasing my shoulders, taking my breath in at the top. Now with the breath in at the top, you can also utilise a lift of your pelvic floor, particularly if your focus is pelvic floor rehabilitation. You want to make sure that you're lifting before you push back into a squat position, which can create a lot of downward force down through that internal connection to the pelvic floor sling. So if you want to take your breath in at the top and lift the pelvic floor before you transition into your squat position, you can. Remember, don't let the tailbone lift, don't create excessive tension in your lower back. Think about tucking your chin all the way under. Press your hands into your thighs. As you exhale to scoop your abdominals, push your feet into the mat, send your shoulder blades wide and apart. Create this lovely barreled out chest, and then exhale, push your hands into your thighs to round your upper back, rolling yourself on upright, lifting the vertebrae tall at the top. Floating the sternum, relaxing the shoulders. Let's do another one, a nice deep breath in. Push the bum back and down, run the hands down the thighs, softly bending at the knees, as if you're sitting on the edge of the toilet seat. Tuck the chin all the way under, so you're closing your neck but opening your cervical spine. Exhale, scoop those abdominals, push your heels into the mat, send the shoulders apart to widen through the upper back, and then exhale to roll, scooping, lifting the vertebrae upright, as you lift your chin and sternum, relaxing the shoulders. Beautiful. Now for the next thoracic mobility exercise or stretch, you can utilise your Fitball. If you don't have one, you can also use a chair. If you want to, depending on your knee tension, you can pop a pillow underneath the knees. Now this move requires some shoulder flexion as well as some deep knee flexion. So if you're uncomfortable sitting on your heels like so with the knees in this full range of flexion, this might not be for you. There is also a variation where you are in more of a full-point kneeling position. I can show you that one, but again, there's a lot of downward pressure on the knees. So just check in with this one, if your shoulders are okay, if your knees are okay, and your hips are okay with this. So in this position where I'm sitting on my heels, I'm positioning myself on a pillow. I'm going to place my hands about shoulder width, no wider, on the ball. Now I'm going to roll the ball away, so I want to make sure that I'm utilising my T-zone just because I don't want to be over excessively arching my lumbar spine. So I'm going to take a deep breath in and then I'm going to roll the ball away. Now as I start to roll the ball away, I'm going to start to hinge forwards at my hips. I'm going to keep my buttocks on my heels. As I roll the ball away, I'm getting a nice lat stretch and I'm going to let my head drop underneath my arms, coming into a nice thoracic prayer stretch. Hold for a breath in and out, some deep long breaths here, and then gently roll the ball back on in. Good, sit yourself on upright, take a breath in, have a go again. Push your hands into the ball, start to roll the ball away, lengthening the arms. Now keep the arms fairly straight. As you pull your buttocks to your heels, reach forwards by pressing your hands down into the ball, coming into a nice shoulder and lat stretch. Let your head disappear between your arms. Take a nice soft breath in and out, and then on the exhale, utilising the abdominals, gently roll yourself back on in. Sit upright for a breath in. Each time you do this, you might find that the head disappears a little bit lower. Try keeping the buttocks down on your heels and try to prevent the lumbar spine arching. If you move into a deeper roll-out position on the Fitball, so as I roll it out, I'll show you. As your head disappears between your arms, and now you can quite clearly see that my ears are just lower than my armpits. I'm trying really hard to pull the tailbone down, keep the buttocks on the heels, so I'm not arching and stressing my lower back. Now, depending on your thoracic mobility, you may find that the head completely disappears between the arms. Keep drawing the tailbone down, keep the abdominals working, and each time you go through this, you may find you drop a little bit lower and get a nice stretch through the lats, getting into that thoracic mobility. Now, the alternative for this is to be in a 4-point kneeling position, or more or less. It means being up on your knees. So this is a slightly difficult variation, and it's going to give you a lot more of range to move into, but you need to control the lumbar spine and the tailbone positioning, because you don't want to exacerbate lumbar spine arching, particularly if you have an issue or condition in that range of the spine. So I'm up in high kneeling, and I'm going to utilize a glute squeeze to draw the tailbone down, so I'm not going to arch through the lumbar back excessively, although I will have a small lumbar spine stretch in this too, but I want to be aware that it's manageable. T-zone is on. Again, in this position, I'm going to start with a nice soft breath in, pressing my hands into the ball. I'm going to start to roll the ball away. Now, keeping myself upright with my glutes on, I'm going to hinge forwards from the hips to lower my chest roughly in line with my hip bones. Now, I'm keeping my glutes gently active, so I'm not forcing the tailbone to lift. And I'm getting a good stretch here in this thoracic prayer position. As I slowly come upright on the exhale, I want to squeeze my glutes, roll the ball back in and come on upright, checking I'm not over-exacerbating that lumbar spine. Take a deep breath in and have another go. Keeping the glutes on so you're not arching through the lower back, remember. This is about the upper spine. We roll the ball away. I'm going to press my long arms into the ball as I hinge forwards from the hips, bringing my chest down, letting my ears disappear between my arms. Now here in this position, if I was to let my tailbone go, you would see I'm tilting the pelvis really forwards, and now I've lost this connection to my mid-back, and I'm actually quite in an uncomfortable position with my shoulders now, and I can feel my tailbone is lifted and I'm splaying out underneath my pelvic floor. To correct this, lift those abdominals, draw the tailbone softly down, and immediately the stretch goes from my shoulders to between the shoulder blades in that thoracic range. And I can get a little bit more range by just relaxing at the neck and letting the head disappear. Again, if this is very tense on the shoulders, this may not be for you. If you have difficult shoulder flexion, don't attempt this one. I'll show you one more time, keeping the glutes on, keeping the tailbone drawn down. I've got my T-zone working. A deep breath in. I'm going to roll my hands into the ball, reaching forwards. Once I've got the maximum range, I've reached as far forwards as I can, I'm going to push my arms down. Now they are shoulder width, those palms. So as I reach forwards, I'm pushing the long arm into the ball to hinge forwards at the hips. I'm trying to keep the tailbone softly drawn down, the abdominals lifted. I can get a little bit more range as I lower the head down between the hands. Take a deep breath in and out. Don't let the tailbone lift, don't let the pelvis be tilted forwards, keep the T-zone working. A nice deep breath in and out to feel the upper back stretching. And then on the exhale, I'm going to utilize the abdominals. I'm going to C-curve the upper back and roll myself back in, squeezing the glutes to bring me upright. Beautiful. Now there is a reverse position to that stretch where you are seated on the ball and move into supine, using the ball for balance and stability. I'll show you that here, but be aware that this exercise may not be for you. So you're going to come to sit on the ball. Now you want to make sure the ball is the right height for you. Mine's slightly too high for me. I need a slightly smaller diameter ball, but I'm still able to show you this stretch. So you want to make sure the feet are hip width. You're able to ground yourself on your sit bones to sit tall. You can have one hand on the wall, one hand on the ball as you move down. Now you want to make sure your T-zone's on, and as you walk your heels gently away from you, you're going to tuck your tailbone, draw your pelvis into this tilt backwards position. Drawing your ribs towards your hips, gently roll yourself on down, keeping that pelvic tilt. Now as we come into position on the ball, notice that my knees are at a 90-degree angle. I've still got the feet hip width. I'm going to squeeze my glutes and draw my tailbone down to come into a posterior pelvic tilt. Now in this position, my mid-back, my lower back is centered on the ball, and I'm pushing into my heels, so I've got glutes and hamstrings on, and I've got a stretch of my hip flexors. Now I'm going to allow my head to gently roll back. So I'm getting a nice opening of rib to hip, yes, and I want to control the range here to prevent the tailbone being pulled back and arching through the lumbar spine. So keep the glutes on. I'm going to take a nice soft breath in, reach the hands directly over the chest, following the eye line with the thumb. As I exhale, I'm gently going to reach back. Now as I reach back, I get to the point where I've extended the arms fully and the back of the crown or the back of the head is resting on the ball. I want to squeeze the glutes, draw the pelvis back, push into the heels so the bottom half of the body is quite tense, and I'm getting a nice thoracic stretch. Notice that my back is contoured to the ball, apart from the draw down of my tailbone and the squeeze of my glutes, which draws the lumbar spine into that small posterior pelvic tilt, whilst I'm releasing through the upper back. Take a deep breath in and out here. Remember that this requires quite a lot of shoulder flexion, a lot of neck flexion, and it may not be comfortable for you in this position. To come on out, I'm going to take a deep breath in, bring the hands back over the chest, drop the chin to the chest, and I'm going to exhale, sink the ribs towards the hips. Quite familiar position in a roll down. Place the hands on the thighs, you can use a hand on the wall. Walk your heels back towards you, scooping through the abdominals, round the upper body upright to come on up, and sit tall once more. And that could be your seated thoracic stretch, supine over a ball. Now, the last thing I want to share with you is something that I practice daily. It's called CARs, which are controlled articulated rotations. Now, you want to really immobilize the other parts of the body to really get the effects on the thoracic back. So in this case, you want to irradiate some tension through the lower body. So standing upright, you're going to switch on the T-zone. That's an inhale for pelvic floor and an exhale to focus on the transverse band. Now I'm adding pelvic floor connection because I'm coming into posterior pelvic tilt. So I'm going to squeeze my bum quite strongly, draw the tailbone down, and this will bring me into a small range of posterior pelvic tilt, and I can feel that I've lengthened through the lumbar spine. Equally, I want to think about driving my knees outwards. I'm not actively rotating them, but I'm switching my quadriceps on, and I can feel glutes, hamstrings, quads are on quite firmly. Keep a soft bend in your knees. Think about keeping yourself on upright. Take a deep breath in. In this position, you're going to wrap your right hand over your left shoulder and then wrap your left hand over your right shoulder. You're giving yourself a small hug. Now keep the glutes and the lower body irradiating that tension. Take a deep breath in. Drop your chin to your chest. Try and keep your chin here. Now you're going to come into flexion and extension only of the upper back. So keeping the chin to chest on the exhale, you're going to pull your upper body forwards and down, drawing the ribs towards the hips to come into flexion of the upper back. Don't try and move your lower back, keep your glutes firing, your tailbone down. Take a deep breath in and then lift yourself on upright once more. Good, keep the chin lightly tucked to chest, don't move it. Exhale, sink the ribs towards the hips to come into flexion of the upper back. Keep the chin tucked to chest on an inward breath. Gently lift the rib cage upright. Keep the tailbone drawn down. Keep the lumbar spine long. Deep inhales and exhales. Keep irradiating that tension in the lower body. Exhale, ribs to hips. And then inhale, upright. Good. As you exhale, chin to chest, sink ribs to hips. Just the upper back is rounding, very similar to your roll downs. Take a deep breath in. Lift the rib cage upright, trying not to arch through the lower back or switch the glutes off. Good, do another one of those. Chin to chest, keep the back teeth together. Exhale, ribs draw to hips. Sink yourself forwards, opening up the thoracic back. Draw the tailbone down. Inhale, lift yourself on upright. Good, we're going to come into that flexion, so exhale, ribs draw to hips. Sink them down. Take a deep breath in here. Now holding that flexion of the upper back, you're going to just have a small amount of twist either side. Keep squeezing the glutes, irradiate tension through the lower limbs. On an exhale, you're going to twist your rib cage to the right. Good. Inhale, come back to center. Keep the flexion in the back. Exhale, twist to the left. Good. Inhale to center. Use your hands pressed into your shoulders to twist the rib cage from the hips. Just side to side gently. Good. Check in with the glutes. Check in with the tailbone. Check in with the quadriceps. Check in with soft knees. Check that the abdominals are still working in the T-zone. Check your chin is to chest. The back teeth are gently closed. Good. One more each side. Good. Now take it into lateral flexion. So come back to the center, ribs drawn to hips. And then sink your right rib cage over to your left hip, keeping your hip bones level. Good. I'm still irradiating tension. Inhale to center, chin to chest still. Exhale, lateral flexion. Good. Inhale to center. Good. Keep the belt line level. Keep thinking about keeping the lumbar spine quite long. Tailbone softly drawn down. Good. Inhale and exhale. One more. Inhale and exhale. Gently let go. Let yourself float upright. Keep your hands where they are. So moving into full range motion, we're going to add all three together. Flexion, rotation, extension, and upright. So it's a semicircle pattern that you're creating. Now you want to be aware that you're still irradiating tension. You've got your glutes drawing your tailbone down. So you're limiting this movement through the lumbar spine, and it's quite high. It's quite difficult to get this motion without letting other parts of the body move. Try and immobilize those. Just keep the upper body, the rib cage, doing the motion. So I'll demonstrate for you. It takes a long time to cultivate a really dedicated practice. Switching onto the T-zone, having soft knees. Remember, squeeze the glutes, gently draw the tailbone down. Think about turning the knees out to irradiate tension in the quadriceps. Good, take a deep breath in. Chin lightly tucks to chest. To begin, you're going to exhale, sink your ribs towards your hips. Keep the tailbone drawn down. Come into the upper back flexion. Then on the next exhale, you're going to rotate your rib cage over to the right hip bone. Sink your ribs to your right hip. Then you slowly bring yourself on upright. Inhale. Take it to the other side. Ribs draw to hips. Then twist your left rib cage to your left hip bone. Sink your left rib cage to your left hip in lateral flexion. And then inhale, bring yourself on upright. Good, have another go. Exhale. Twist to the right. Lateral flexion, right rib cage to right hip. And then inhale, upright. One more. Ribs draw to hips. Twist to left rib cage. Left lateral flexion. Inhale, upright. Good, keep the glutes on. So that's half a measure. Rotation, twist and lateral flexion, and then upright. To make it into a full fluid circle, you need to add the two together. You want to be aware that this is not creating any pressure or any pain or any discomfort within the back, which is not just stretching. You want to utilize your abdominals, your ribs drawing towards your hips, and you want to utilize the tension that you're creating. It's quite a strong exercise. So I'll demonstrate for you from the front and the side. Again, I'm irradiating tension with the T-zone on. I've got my tailbone drawn down, chin to chest. Take a deep breath in. Exhale, ribs towards the hips, making sure I'm coming into the flexion of the upper back. I'm going to twist to my right rib cage. Good, then I'm going to exhale, drop my right rib towards my right hip bone. And then I'm going to inhale upright, keeping the chin to chest, the back teeth together. Then I'm going to reverse it. So I'm going to go left rib to left hip bone, lateral flexion. Then I'm going to rotate my left rib cage down and come back to center. Good. Then inhale, bring myself on upright. That will be one fluid pattern of a calves rotation. So you can see I'm incorporating lateral flexion, twisting or rotation, lateral flexion and extension, all of just the upper back. So that would be what we would call our calves, and that's a daily practice for mobility. If you want to know any more information, you can always email me and I can let you know. Have a go with your calves, even if it's just the half, the rotation and the lateral flexion, and try and utilize immobilization of the lumbar spine by using that squeeze and draw down, coming into that small range of posterior pelvic tilt. I hope this was informative for you. You can also add in your cheeble thoracic opening, where you're laying on a full or half ball, and you really encourage the rib cage to stretch wide. That would also be a nice daily inclusion into this if you want to use this weekly to release pressure through your upper back. I hope you had a good session, and I hope to see you next term.